Hello everyone, this is the audio visualized recording for the organic chemistry whose topic is drugs. Firstly, we will discuss about what are drugs and medicines. When we fall ill, we take some tablets, pills, injections or apply some ointment to get well. All these are collectively known as medicines. Sometimes we may use some pairs of plant or some preparations made from herbs, minerals, animals, etc. All these substances used for the treatment or prevention of disease can also be called medicines. Medicines contain a single chemical or a number of chemicals in different amounts to have a desired effect. The mode of action of the chemicals of a medicine is quite varied and complicated. In many ways, the cases of action may not be fully known to us, but we continue to use them useful to us. Early men used several plants or parts of plants to cure disease without knowing of the chemical component responsible for it. For example, bark of willow tree used for relieving pain, that is analgesic. Later it was found in bark contained 2-hydroxybenzoic acid, which is closely related to acetyl salicylic acid, also known as aspirin. Parts of a plant Roivolfa saprentia, Hindi name Sapragandha, have been used in Ayurvedic drugs for the treatment of hypertension, high blood pressure. Later, it was discovered that the compound called respirin was responsible for reducing blood pressure. The respirin became the first modern medicine to control the blood pressure. In most of the cases, natural lead to the discovery of modern medicine. Thousands of chemicals all over the world are constantly searching for better, efficient, cheaper, and safer medicines. As mentioned earlier, the term drugs and medicines are usually interchangeably, but there is a difference between the two. Let us try to understand the difference between drugs and medicines. The term drug is often used for preparation or whole use chemical components on their quantities and also known fully. They may be extract or certain plants, herbs, animals, plants, or maybe minerals. The term medicine is used the chemical composition and quantities of the various chemical components are known. Further, the effects of chemical compound present in medicine and their have properly extensively studied. The medicines are approved and relieved that are relevant to government authorities like Drug Controller of India. Classification of medicines. You may be familiar with some of the medicines which is used for relieving pain, reducing fever, for treating common cold, etc. The number of medicines is very largely, therefore medicine are classified according to their action or use. Now we will term these medicines as analgesics, antibiotics, antiseptics, etc. are common household words which is used like antipyretics, which reduce body temperature, antihistamines, which reduce allergy, analgesic, reduce pain, antimalarial, used to treatment of malaria, germicides, kill germs, antiseptic, kill germs, can be safely used on living tissues. Disinfectants, antacid, which used to reduce acidity in stomach, anesthetics, loss of sensations, antimicrobial, kill microorganisms, tranquilizer, hypotonic, reduce anxiety and bring calmness, birth control medicines, birth control. Now we will firstly discuss about antipyretics. Antipyretics are the substances which are used to reduce body temperature to control fever. The word antipyretics is derived from the pyro, which means fire, means hot. Anti means against. Thus, antipyretics means contracts heat, मतलब हाई बॉडी टेम्परेचर के अगेंस्ट जो काम करे, जैसे कि एस्पिरिन, पैरासीटामोल, फेंटेसिटीन, फेनिसिटीन are commonly antipyretics. You get them in the market and the different trade name like crocin, anacin, disprin, etc. This is the structure of aspirin and paracetamol and phenicillin. Aspirin is the most popular antipyretics which we use. It gets hydrolyzed in stomach and salicylic acid is released. Overdose and using it over a long time may cause side effects. It may cause bleeding in the stomach wall and even ulcer. Therefore, overdose and prolonged use should be avoided. However, calcium and sodium salt of aspirin are more soluble in water, are less harmful than aspirin. Now we will discuss about analgesic. Analgesic are the substances that reduce pain, which may be swelling of tissues, injury, inflammation, and other disorders. There are two types of analgesic, that is narcotic and non-narcotic. Narcotic analgesic are those one which induce sleeps, जिससे हमें नींद आए. That are narcotic analgesic. This help to reduce the feeling of pain. Alkaloid present in opium, morphine, codeine, etc. are common example of narcotics. In higher doses, they may be used unconsciousness. These are habit of forming and causing addiction. Due to addiction of a person wants to have a regularly and large amount, such a person feels upset and uncomfortable if he does not get it. Narcotic analgesics do not induce sleep or not habit forming. A common example of this type of narcotic is morphine. Hence, this is the structure of morphine. We can say that. नाउ द नेक्स्ट स्ट्रक्चर इज या नेक्स्ट हमारी जो मेडिसिन है वो एंटी मलेरियल मेडिसिन आर यूज टू ट्रीट मलेरिया. क्विनिन एंड क्लोरोक्विन are widely used as antimalarials. Quinine is the one of the earliest drug which was first obtained to the bark of plant Cinchona and later on the stabilized synthesized in laboratories. That is the structure of quinine. Next, antihistamines. Some drugs are hypersensitive towards some medicines like penicillin, sulfa drugs, and may be sensitive to food, environment due to different sensitizing substance derived from them. Thus, hypersensitivity is called allergy. It is due to the release of chemical substance called histamine in the body. Antihistamines are the chemical substance drugs which control or abolish the effect of histamines released in the body. These drugs are also called anti-allergic drugs. Histamine is responsible for the nasal congestion like mild asthma associated with the common cold, cough, allergic responses to the pollen grain, etc. Histamine contracts the smooth muscles in bronchi and guts, releases other muscles present in the walls of fine blood vessels.